Good morning, everyone. Thank you for joining us for today's webinar, How is COVID-19 Impacting Mobility, Health, and Teen Driving in North Carolina? Before I introduce our presenters, I would like to cover a few housekeeping topics. Please make sure you are muted throughout the session. We encourage questions. All questions will be addressed after the presentations are over. Please submit your questions in the chat box. If you think of a question for the speakers at any point, just type it in there and I will hold it for the discussion portion. Today's session is being recorded. HSRC will make the recording available at a later date. We welcome you to revisit the content and share it with your colleagues. Today's presenters are Dr. Katie Harmon, Natalie O'Brien, and Dr. Randa Radwan of the UNC Highway Safety Research Center, and Dr. Arrianna Planey of the UNC Gillings School of Public Health. I am going to hand the floor over to Randa Radwan now, who is going to start today's presentation.
Good morning, everyone. I see we have one more person to admit, and thank you very much, Wes. Let me go ahead and share my screen. So welcome. Today we'll be sharing initial results from a research study on COVID-19 mobility and health impacts in North Carolina. This study is led by the UNC Highway Safety Research Center and is funded by the North Laboratory at UNC. Now, as you know, that this pandemic is affecting all our communities in so many different aspects. In this study, what we're interested in is studying the interrelationships among public health policies, mobility changes, traffic safety, and the burden, i.e. transmission and impacts of COVID-19. What we're hoping with our study is to inform data-driven policy decisions in North Carolina. So our work, this research is funded by the legislator. And we are hoping that the studies of our trends and the inflections will be helpful as we know that, and hope not, but there's a resurgence of these infections due to cyclical outbreaks throughout the year. Now, in addition, given that this will not be the last pandemic or disaster, we are hoping to develop expertise, foundational research, and build data infrastructure at UNC Chapel Hill for mobility research to involve future infectious disease pandemics. Now, at this time, I'd like to introduce my co-presenters, and I would appreciate if you guys can all turn your screen, your videos on so folks can see you. So first, it's Dr. Arrianna Planey, and Arrianna Marie Planey, who is recently joined UNC as an assistant professor in the Department of Health Policy and Management, Geography and Management. And her PhD is in geography. And she will be covering the literature synthesis in the beginning of this webinar, as well as come back later on to present some case studies. Second is Natalie O'Brien, who's a researcher at UNC HSRC, and she is a psychologist by training. And Natalie will be giving us initial results from a study of the effect of pandemic on teen drivers. I, who am the PI for this project, as well as the director of UNC HSRC, I will be giving some initial mobility data trends. And I would like to acknowledge that Wes, who introduced the speaker, Wes Kumfer, he is the task lead on this, on the analysis of the mobility data. And last but not least is Dr. Harmon, who is a researcher at UNC HSRC as well. And she is the epidemiologist on our team. And she will be discussing some health data trend. Now, this is what we're going to present today is part of a larger study. And we want to let you know that we have a multidisciplinary team from other parts of UNC, including the Shep Center and UNC Gillings School of Public Health, and as well as the Odom Institute, and a professor of statistics from NC State University. Now, just to give you a sense of scope of the study or context, So we have a lot of tasks in the study, and today we're focusing on the literature synthesis, review, and of additional of this and synergetic studies. And then we're gonna provide just some initial results from analysis for C19 mobility and health data. And we're going to share initial results of the study, the effects of COVID-19 on young drivers and implication for policy. At this point in time, I also want to point you to our website. We have a website for which you can get more information. And if Wes, if you don't mind putting the website in the chat box, that would be great. I would like to turn this on to Dr. Planey for the literature review. Go ahead, Arrianna.
Good morning. So next slide. Oh. Okay, so we had 5 key themes in our literature review for this project. The first is that the COVID pandemic has had a disproportionate impact among both older and younger Black and Latinx people, who are also overrepresented among essential workers in the US. The second point is that in rural places, higher comorbidity or prevalence of chronic conditions, older populations in conjunction with scarce healthcare resources has meant that the pandemic has had more deleterious effects in rural places. Third, so we can characterize the transmission of COVID, of the virus that causes COVID, as primarily being driven by domestic community spread at this time. And this is particularly true in rural places where cases are growing quite rapidly. And this is true in North Carolina. And one of the reasons we're pursuing this project is that density is actually, so population density is actually an insufficient explanation for COVID spread. There were a lot of prior early studies on this area, but it seems that we must account for mobility. And for example, New York City is quite dense, but its outcomes underscore the importance of policy in shaping outcomes amid this pandemic. And finally, rapid increases in overall mobility have been associated with increased COVID-19 incidents. And this is also potentially moderated by income and occupational sorting, as well as access to broadband internet, which is really a prerequisite for being able to work remotely. Next slide. Okay, so in North Carolina, COVID cases currently exceed 249,000. And among cases where race and ethnicity are reported, about 50%, 23% are among Black folks and 35% are among Latinx folks. This is, suggests a disproportionate impact in these communities in North Carolina. Rural places, just reiterating this point, rural places in North Carolina have less healthcare capacity, older population, less testing capacity, and heavier burdens of chronic illness, which are associated with COVID symptomology. So it would be right to suggest that cases are possibly being underestimated, and that we're really just seeing the more severe cases. Nationally, congregate living settings such as nursing home, long-term care, and prison account for nearly half of COVID-attributed deaths in the US at this time. Next slide. So in North Carolina specifically, there are 364 clusters associated with nursing homes, residential care facilities, and correctional facilities. And this is from the North Carolina Department of Health and Human Services. In terms of the disproportionate impact in Black and Latinx communities, here's a recent study that came out looking at the research triangle. And basically, the findings showed basically what we already know, so that Black and Latinx neighborhoods in the research triangle are disproportionately more likely to test positive. So residents in these neighborhoods are much more likely to test positive for the virus that causes COVID. And in terms of mobility, it's important to start with an understanding that mobility is stratified by race, ethnicity, and class. Prior to the pandemic, the most mobile people were actually the highest income workers. But their mobility decreased the most when shelter-in-place orders were implemented, compared with low-income workers. And also notably, Black and Latinx workers are far less able to reduce their work-related mobility because they're more likely to work in jobs that are considered essential work, and less likely to work in jobs that can be done remotely compared to with their white counterparts. And statewide shelter-in-place orders were also associated with decreased median travel distance and increased stay-at-home dwell time. So these are two measures of mobility that are being used in the study at the county level. However, these downward trends in mobility nationally have reversed when states began reopening, in May 2020. And these are some references, you should come back to that later.
Yes. Thank you, Arrianna. Appreciate the synthesis. Next, Natalie will be discussing the effects of COVID-19 on young drivers in North Carolina. Go ahead, Natalie.
Thank you. Yes, so we're going to be talking about the effect of COVID-19 on young drivers in North Carolina. And why that's important to do is because crashes are a leading cause of death among teen drivers. Okay, the next slide. As you can see here, in 2018, crashes accounted for 25% of deaths among 15 to 18-year-olds. So research shows that the primary factor contributing to teen driver crashes is inexperience. If you look here on the right, this is showing basically a learning curve. When teens first get a license to drive independently, they have high crash rates for the first, starting off initially, and then over the next 6 to 12 months, they decline pretty sharply. So even though teens have these high crash rates, we've seen substantial reductions in their crashes over the last 2 decades, and that can mainly be contributed to the implementation of graduated driver's licensing, which is commonly known as the acronym GDL. So when GDL was implemented in North Carolina, we saw a reduction of 38% of crashes in 16-year-olds and 20% in 17-year-olds. So what GDL is, it's a licensing system, and what it does is basically gives teens practice in safe situations, while also reducing their exposure to more risky situations. So there's 3 phases of GDL. Right here, I just have you an example. This is the North Carolina system. And the first stage is the learner's permit. During that, well, actually, before you can get your learner's permit, they must first complete driver's education. Then they will have their permit for a minimum of 12 months. And during that time period, they have to have supervised driving practice. And in North Carolina, that has to be a minimum of 60 hours, with 10 of those being at night. Once they've successfully completed that phase, they can then get a provisional license. So they must hold their provisional license for 6 months. And during that time period, they can drive without supervision, but they can't drive after 9 p.m. and can't have more than 1 teen passenger. Once they've completed the second stage, they are then eligible for the third, which is a full provisional license. So even though we know that GDL is highly successful, several states, including North Carolina, have introduced or passed legislation to relax the licensing requirements that are in place due to the perceived burden of COVID-19 on young drivers and their families. So far, North Carolina has waived the road test requirement for new drivers, basically to fight the spread of coronavirus, because you can't be socially distanced when you're in a car. And so in order for teens to get a license, they're allowing them to get it without taking the road test with an examiner. It also was proposed to reduce the permit phase, so the time that they would practice with a parent supervisor, from 12 months to 6 months, which would mean that teens are having less time to get the practice that's needed. So the main concern behind this legislation is that teens would have reduced mobility due to just the restrictions that have been in place, because DMVs during phase 1 of the state state's closure, only 30 DMVs were open. Now most are open, but there are long wait times to get an appointment to come in. So there's the concern that they basically can't get into the DMV to get a license. And there also are concerns about access to driver education, because whenever the state, during the first phase, on March 16th is when driver's education also shut down. So in-person classes couldn't be offered. As of April 1st, they could offer them remotely, but a lot of programs are not capable of doing that. And so they're still trying to realize or determine how they can implement their education in a virtual setting. So this table here, it shows the fourth quarter, and it's comparing 2019 to 2020, and this is the spring, early summer numbers. The biggest difference you can see here is in the behind the wheel. That's when students have to practice with a driving instructor. They're required to do that for at least 6 hours before they can complete driver's education. And so this spring, early summer, we only had 21 students across the state being able to complete that behind the wheel training compared to about 22,000 the previous year. So there's currently a pretty substantial backlog in driver's education. So these things are prompting the concerns about teens not being able to get licensed, and maybe legislative changes that need to take place to allow them to. The next slide, please. However, we do have concerns about teens' mobility, but we need to look at what the safety implications of these policy changes might be. We know from research that most teens, they get most of their practice from routine trips. So driving to school, to sporting activities, or other common destinations that they need to go to. So with schools closed and many activities canceled, there's concerns that teens are getting less practice than they normally would. So if you combine that, the concerns with less practice, and then they do not have to currently take a road test to prove their competency, it's possible that we're going to have more unqualified new drivers on the road. So in order to look at this, we are examining licensing data and also crash data for teens. This first graph is showing licenses issued to 16 and 17-year-olds since 2016. So generally over time, these have been pretty stable. Each year, approximately 96 teens get a learner's permit, and 73,000 teens get an intermediate license in the state. But as of March 2020, you can see that substantially dropped. It basically, for the intermediate licenses, went to 0. It then rebounded in July when they began allowing the road test waiver. But permits have stayed somewhat low because driver's education is still not fully operational. This next slide shows the young driver crashes, and it's looking at, we're just comparing 2020 to 2019. Both time periods are starting in January. So we're looking about 30 weeks worth of data for each year. And the 2019 crashes were pretty stable. We had about 400 crashes per week for 16 and 17-year-olds. And that was pretty stable across time. But same thing, starting in about March of 2020, crashes decreased substantially. And for the 16-week period from March 2020 onward, crashes are about 54% less than they were in the previous year. So we know that the closure of schools and the statewide stay-at-home order clearly had a substantial effect on young drivers. New permits and licenses issued dropped substantially, and also crashes decrease, likely signifying less driving among teens because of schools and other activities being canceled. However, provisional licenses rebounded after the road test waiver was instituted in July. So currently, we don't know what the long-term effects are of allowing the road test waiver on crashes. So we're going to continue to look at crashes and licensing trends for the rest of 2020 to see what the implications are. And we're also currently in the process of conducting online surveys and focus groups with parents of teen drivers who had a learner's permit during this time period to see how they were affected. Their practice was affected, and also what parents think about the legislative changes that have been proposed and if they support them or not.
Thank you, Natalie. Appreciate it. And just want to reiterate, if you have any questions for Natalie, if you can, and or Arrianna, to please indicate that in the chat box. So at this point, we're going to move to the next part, which is providing initial results on trends for both on mobility and health in terms of cases and deaths. Now, I'm just going to put our initial research questions all at the same time, because we started with these, have these orders affected mobility, reduced movement? Were there any differences between different areas, counties, urban and rural? Can we compare, how do the health trends compare to mobility trends? Are there any temporal and geographic differences in the frequency of these cases? Now, of course, as we learn more and more in the synthesis, we realize that there's yes to most of these questions, but how does that reflect in North Carolina specifically? Our data sources for mobility and health, first we use the vehicles mile traveled from Streetlight, origin and destination data from Teralytics, and mobility and contact indices from Cubic. It's worth noting both Streetlight and Cubic data are based on location of individual devices, i.e. people who have opted in to provide that data for over 100 plus apps, and there's the population is 15 million samples. Teralytics is origin destination data based on cell tower data, pinging devices as well. With the health data, Katie would discuss more, where we basically at this stage had scrubbed the New York Times data for by county for COVID counts and deaths, and we kind of normalized the exposure data with the US Census. So in this slide, we have trends of vehicle miles traveled, 7-day rolling averages. We're looking at trends for urban, suburban, and rural. And the time period basically goes from the beginning of the year through late July. The vertical lines indicate the different times for the orders for the declaration of state of emergency March 10, stay-at-home order March 30th, May 20, beginning of phase 2, and mask use mandate June 24. The urban trends are in blue, thick blue, and then the dotted lighter blue is the rural, and then the suburban is the dark blue. And what's worth noting is for each of these areas, there was a significant drop right after the declaration of state of emergency. But pretty much by middle of June, things stabilized and back to more seasonal norms. But what's worth noting here is the drop was most pronounced for urban travel. Now, for our county classification for rural, urban, and suburban, we use the designations from the North Carolina Rural Center, and this is just a map just to give you a view of the counties. From Teralytics, although we had data accessible for shorter time duration through the end of April, what was worth noting is when we looked at work trips, and this is the way they define work trips, is dwell time. Like they had two, like if you're at home, they had two designations going to work. One of the two designations is you spend the next most long period of time versus staying at home. So here the urban is in light blue, and all these are significant drops, but the most substantial one is in urban areas. And I mean, not surprising, folks in the urban areas were able to work at home more than in the rural areas, who had to still travel long distances, given that they represent a higher percentage of essential workers. Now, next, I would like to discuss a mobility index. And just to orient you here, we are comparing median statewide mobility index from Cubic from 2019, which is the more steady line blue on top, compared with 2020. And the mobility index is a measure of median distance traveled by all devices. This is a logarithmic scale, and that's why you see these numbers, and I will talk a little bit more about it. But this is not miles traveled. This is basically, you think of a box, and if you stay within a certain mile, say mileage or 1 kilometer all day, or within a particular day, you stay within a certain range. And in terms of resolution, Cubic has 10 meters, 100 meters, 1 kilometer, think up to 100 kilometers. So what we have here is that the CMI dropped from around 4.1 to 3.5 within this period after the emergency declaration. And that corresponds to a reduction in movement for a distance of 8.5 kilometers for the median user. Now, when we take a look at the relative trends between the different designations, rural, suburban, and urban, again, we see a similar trend where this movement, the indicator is there's a much more substantial drop in urban areas. And then the lighter solid blue line represents the rural CMI index. Now, another measure that we are very excited about from Cubic Index, which kind of is a surrogate for social distancing, is something called the Cubic Contact Index. And the CCI measures if more or two devices come within 50 feet of each other within a 5-minute time period. And the official definition here is a ratio of number of devices in proximity to the number of devices in the area. And here we do also have a comparison from 2019 in blue, light blue, dotted with the darker blue in 2020. And we see that there's a drop in that contact. Then that's a median across the whole state. And then it does recover, but people still maintain a level of social distancing, which is encouraging. Now, to compare this, what we saw before was statewide. This is a look at about the differences in the trends, rural, suburban average contact indices, and it's really worth noting that we saw a very slight drop in the rural CCI relative to the much more substantial drop in CCI, and one can note that folks in the urban area are more able to stay within this context of social distancing due to their work environment and etc. So overall, in summary, all the area types that we looked at did show statistically significant decreases in every mobility metric after the state emergency direction. And here I'm referring to the CMI and the vehicle might travel. With the CCI, we did not see a drop in rural area. Now, urban work trips had a more pronounced response to the pandemic than rural suburban work trips. The travel did stabilize in early June. And despite travel and movement changes, we have seen that contact index did show that social distancing has taken effect. With this, I'd like to turn it over to Katie, and when she has a chance to share, go ahead, Katie.
Thank you, Randa. My name is Katie Harmon. I'm an epidemiologist at the UNC Highway Safety Research Center, and I'll be covering some of the North Carolina COVID-19 cases and death trends that were observed in our state. Next slide, please. So in order to add context to the North Carolina mobility trend analysis, we need to track COVID-19 trends and major policy shifts in our state. This figure displays the 7-day rolling average of confirmed COVID-19 cases and deaths for the period March 1st through September 30th, 2020. After Governor Cooper's state of emergency declaration on March 10th, Cooper implemented Executive Order number 121 on March 30th. This order, more commonly known as the stay-at-home order, directed people to limit trips to essential businesses, to avoid gatherings of more than 10 people, and to stay 6 feet apart from non-household members. Since that time, we have moved through various phases in which some restrictions have been relaxed while other transmission mitigation measures have been enacted, such as the mandatory mask requirement, which was implemented on June 26th. Although not displayed on this figure, we are now in phase 3, which relaxes most restrictions on travel and large gatherings and allows all establishments to open as long as they follow state guidelines, such as limiting occupancy. As of September 30th, the highest peak in statewide case counts was observed in mid to late summer. This excludes the antigen test results that were released on over a course of a few days in late September. And these antigen test results reflect historical cases. It is important to note that not all cases of COVID-19 are confirmed through testing, so the number of COVID-19 cases reported is likely an actual underestimate of the true number of COVID-19 cases in North Carolina. As Dr. Planey mentioned previously, these case counts are already out of date, as we have added nearly 50,000 more cases since the end of September, and trends are beginning to look up, unfortunately. Next slide, please. Similar to what we observed in our mobility analysis, there is variation in COVID-19 trends by urban, suburban, rural county classification. Starting in late July, rural county case counts, indicated by the yellow line on this figure, have exceeded urban and suburban case counts. Next slide, please. When we adjust for population size, differences in the burden of COVID-19 becomes even more stark, with rural counties having 17% higher confirmed COVID-19 cases per 100,000 population and 36% higher confirmed COVID-19 deaths per 100,000 population as compared to urban counties. And in these two figures, the rural counties are indicated in yellow. Next slide, please. Not surprisingly, we also have observed differences in the number of reported COVID-19 cases and deaths per 100,000 population by county of residence. Counties located within the coastal plain and eastern Piedmont have been disproportionately impacted by the pandemic. There are many factors influencing COVID-19 transmission at the county level, many of which Dr. Planey discussed as part of her literature review. As a case study, I will compare Orange and Durham counties, next, which have had very different experiences with COVID-19. And of course, I didn't pick these counties randomly. I live in Durham County and I work in Orange County when there's not a pandemic. And I also am part of a split household as a graduate of UNC, and I have a partner who's a graduate of Duke. Next slide. In this figure, the 7-day rolling average of Durham County COVID-19 cases is indicated in blue, and the 7-day rolling average of Orange County cases is indicated in, of course, orange. And as you can see, for most of this period, Durham County had more cases. This isn't surprising. Durham County has a larger population. Interestingly, Durham also reported similar trends to the rest of the state, with cases peaking in June and July, and they have since leveled off. In Durham, as an aside, in Durham County, over 50% of cases have been among members of the Latinx community, despite this community making up only about 14% of the county population. The reasons for this disparity are multifactorial, but likely have some relation to the high proportion of Latinx individuals who are classified as essential workers, and who also work in construction and service industries, which cannot be easily performed from within the home. On the other hand, when we turn to Orange County, we see the fairly low burden of COVID-19 for most of the study period, except for a precipitous spike in late August, which I think we all know what that's related to. Of course, it's related to the university opening. This figure highlights the need to continually monitor COVID-19 case trends at different geographies, because trends can change quite quickly in response to both intrinsic and extrinsic factors, and what we're observing at the statewide level might not be necessarily reflected at the county level or the city level. Next slide. So just to recap some of the health trends and key results, North Carolina COVID-19 cases have fluctuated over time with a statewide peak in mid to late summer. In addition, COVID-19 trends and the burden of cases and deaths vary by county of residence, with rural North Carolina counties containing a disproportionate burden of cases. And thank you.
Oh, thank you, Katie. At this point, we will be moving to some case studies, and we're going to go back to Dr. Planey. Go ahead, Arrianna.
Hi, I'm going to be talking very briefly about the spread of COVID, or the spread of the virus that causes COVID-19 among workers in meat and poultry processing plants. So next slide. Okay, so North Carolina actually has the highest number of meat and poultry processing plants of all states in the U.S. And has the highest share of employment in this sector. So you can see that in this map from the Bureau of Labor Statistics. Nationally, meat and poultry processing plants account for notable clusters. So far, the number is just under 30,000. But 83% of these COVID cases among workers in meat and poultry processing plants are among ethnic and racial minorities, particularly Black, Latinx, and to a smaller proportion of Asian workers, so Asian migrant workers. And this is despite these workers only comprising 47% of the workforce in these processing plants. Within North Carolina, so within North Carolina, there are outbreaks of COVID associated with at least 23 meat processing plants across the state, and I'm not going to list off these names. But next slide. So across North Carolina, there are 209 federally inspected meat and poultry processing plants. And as I mentioned a minute ago, North Carolina actually has the most meat and poultry processing plants, even more than Iowa, which has 171, I believe, as of 2019. Next slide. So here on the left is a map of the zip code level count of migrant worker camps, which are generally clustered near agricultural meat processing facilities in the state. And on the right is the density map of meat and poultry processing plants in North Carolina. It roughly maps, but yeah. Next slide. So here we also see it, not quite, but you can, if you're looking at COVID, the prevalence of COVID as of, say, last Friday, and the density of meat and poultry processing plants, there is some overlap. I'm not going to extrapolate from that, but it is important to understand that like these occupational exposures are an important driver of exposure. These occupational risks are important drivers of exposure to the virus that causes COVID-19. And this is true beyond the meat and poultry processing plant. This is true for nursing facilities, which account for half of mortality associated, COVID attributed mortality in the U.S. Next slide.
Okay.
Oh,
so I want to thank Arrianna and also mention that Arrianna will be taking a closer look into that and be on the look for a tech brief on both these two areas, case studies. So with that, I'd like to turn it over to Katie for a recap. Katie, go ahead, please.
Thanks, Randa. I'm just going to recap two really important figures that were discussed earlier, that I think it's important to just sort of compare back to back, because if you're like me and you're a visual person, you often wanted to compare, say, for example, the mobility trends directly with the health trends. But unfortunately, these figures are a little busy to overlay them together. So this figure is just the mobility index, which is a measure of the median distance traveled by all devices in North Carolina. Well, all devices that are monitored by Quebec. In North Carolina, the CMI dropped sharply in March, but has since returned to near normal levels. Rural counties have a higher CMI than suburban and urban counties, and do not drop as much as the urban counties after the March 10th state of emergency declaration. Next slide, please. And again, this is just the COVID-19 case counts in North Carolina. These are the counts that are reported to the state and during the period March 1st through September 30th, 2020. And as you can see, there has been a peak observed in mid to late summer. However, and then there's a drop in early fall, but now things are starting to trend upwards again, although that's masked a little bit by the fact that the antigen test results were released within a few days. That makes it look like the spike is higher than it actually is. I can verify by more recent data that we've examined that the trends are looking upward for new COVID-19 cases, and this is reflected in most other states within the United States as well as internationally. Next slide. So some further discussion of COVID-related mobility considerations. The closure of schools and the stay-at-home order have had a substantial effect on young drivers. However, we need to continue tracking licensing and crashes during the second half of 2020 to assess the longer-term effect of COVID-19 and legislative actions on young drivers' safety and mobility. On average, travelers are responsive to policy measures, but the impact is greater in places where travelers have more mobility options. The relationship between mobility and pandemics and natural disasters is complicated, but it's important to understand so that we deal with these events so we're able to mitigate morbidity and mortality related to these events in the future. Mobility disruptions to travel patterns will affect budgeting and resource allocations for the North Carolina Division of Public Health, the North Carolina Department of Transportation, and other state local governmental organizations. And there is a need for resilience modeling. And that gets into some of the next steps of our project, which we hope to expand on the results presented.
Yes.
And thank you. And now we'll take some of your questions.
Yes. Now I would appreciate if all the presenters, including Wes, can turn their cameras on. And Wes, if you can let us know the questions. And I have a feeling you probably will be answering some of them as well.
So Randa, there's only been one question in the chat box so far, and I actually already mostly answered it, but that was what modes of travel were included in our mobility data? And just to reiterate the response that I gave to Joe Hummer, Teralytics and streetlight data mostly represent motorized traffic. Teralytics couldn't really distinguish between motorized and maybe some transit in there, but there's no pedestrian traffic. The cubic data are based on cell phone use, so the CMI and CCI could be any mode. However, if we think about the fact that these have to be pinged with apps, then they're probably not on airplanes. And so that was the other question was, does this include air travel? And as far as we understand, no, it does not.
Right. So on that note, what I want to share that although, because this is a very short turnaround project, we need to finish everything by end of December, but what we're doing as part of this project is trying to collect as much data as we can, you know. So for example, we just got what Wes, you could talk, we got some pedestrian data, we have Go Transit. If you want to just discuss the other areas that we have access to, that we hope to have future projects use, whether it's ways, and I'll let you talk a little bit more about it since I know you put that list together.
Yes, so I know our colleagues at ITRI have been monitoring pedestrian and bicycle traffic at their various counters through the NCDOT Count project, and they recently shared that data with us. I have not gotten a chance to examine those trends yet, but I know they've done some work there, and so that information should be coming out pretty soon. We have pulled data from NCDOT as far as the ATR count stations, and we have done some trend analysis on that. Recently updated that data set, and I'm hoping to extend the trend analysis that I did previously. We have also now gotten NCDOT's vehicle miles of travel data set monthly for 2019 and 2020. And we're very interested in comparing that to Streetlight's VMT that they generated from an algorithm to see, you know, what the standard error is between the two and how closely the cell phone derived VMT matches the counting derived VMT that the state publishes. And so we're hoping to publish that soon as well. Obviously, this is a lot of data that will take some time to analyze, but like Randa said, some of this may be coming out sometime after the year ends and after this particular phase of the project ends. There are a number of other interesting data sets that are out there right now. Randa mentioned Waze, which I just had a strange insect crawling on my lap. Rhonda mentioned Waze, which measures traffic disruptions on different highways. We do have access
Incidents.
to that data set. We also have access to SafeGraph, which is looking at foot traffic to different kinds of establishments. We also have pulled data from Apple Maps, which is an interesting data set in that it measures requests for directions by requests for directions walking, driving, or using transit. And I've looked at some of those trends over time, and they match with some of what we presented here. We also recently received access to, although we haven't gotten the ability, or we haven't analyzed it yet, looking at speed data on corridors. And this is one that I think is of a lot of interest to folks around the state, because they want to know, is this perceived speeding behavior that I have seen actually happening? Like, is this actually true? And I know this is one thing that our friends at NCDOT are very keen on us looking at, because they want to know, has speeding actually changed, and does it correspond to some of the changes in traffic patterns that have been observed?
Yes, absolutely. So another analysis as part of the project is just starting, is to look at the effect on traffic safety. And, you know, from analysis that have been done by NCDOT, we know that the number of fatalities and fatalities rates is stayed the same, while the crash exposure has really had a dip. And so trying to understand the why, you know, in speeding, is it anecdotal? Is it related? You know, do we have more preponderance of single vehicle crashes versus not? So this, hopefully, we will have a webinar on this later this year, and once the analysis is finalized.
What other questions do you have? Feel free to type in the chat box. Or I guess if anyone wants to speak up, we could probably try that too.
As well as show your camera, we have a few more minutes. We originally planned this for 45 minutes, but we realized that that would not give everybody a chance to ask questions. So that's why we extended the time.
I forgot to mention during the section on meat and poultry processing plant. The world's largest pork processing plant is actually in Bladen County in the southeast of the state. Employs about 4,500 workers. So just want to give a sense of the scale.
Yes.
Natalie, there's a comment that is directed toward you, and it will be interesting to follow this cohort of teen drivers through time.
You are muted.
Sorry. Yeah, I agree. I think we're very fortunate to be able to work on this project to get this period of baseline data, so we can continue to follow them and see what happens. I've talked to the DMV, and there is a flag as far as the ones who are getting licensed with the road test waiver. There's a flag in their file to indicate that. So that will be interesting to look at going forward.
Katie, can you speak to the additional health data that we're getting, because that's going to feed into another analysis that just starting, which now we showed you trends, health on their own, mobility on their own. The premise is, can we get some linkage or association, look at a point of inflection, and hopefully in some predictive matter in terms of the burden of the disease. Go ahead, Katie.
Sure. We had originally used the New York Times reported cases and deaths, because these are publicly available data. And so we have a very short analysis, a very short time period of when we can actually do the work. And so we wanted to get something we could just start running with. However, we've also in the process of putting together IRBs, as well as some data use agreements with the state, and working with the UNC Shep Center to get access to near real-time emergency department visit data that will document ED visits related to COVID-19. And even more another exciting thing is that we're actually going to be getting access to testing data. And one of the things that we're really interested in is both of these data sets do contain covariates, so they contain information about the individuals involved, which we don't have with our New York Times publicly available COVID-19 case and death data. And so we can sort of start drilling down into some of these hypotheses that we've come up with throughout the beginning of the study period.
Yes. So may I pose a question to the audience? We have more in chat right now, Wes, I see. What particular questions would you like answered relative to mobility and travel in the state?
There are no bad questions.
Mhm.
Yeah, I don't see any in the chat. Well, I'd like to thank everybody for their attendance and all the presenters for the hard work. It's truly a team effort, and we appreciate your time and attention. So we'll cede back a few minutes of your time this morning. Oh, we have one question from Joe, Dr. Hammer. I would like to know what to do about the rural eastern counties. Well, I don't know, Katie, do you want to start? Our whole premise here is to get an understanding, provide some data to our legislators to help them make some decisions. And, you know, if the focus of all this is how does one apply resources or distribute resources, whether testing and, you know, in the future one's vaccine and access and all of that, and highlight the need. So this is what we're hoping to do. And Katie, I'm going to give you, just if you want to talk a little bit more about that, just because I know you're very familiar with that area.
Yes, I am from one of those rural eastern counties. I grew up in Craven County, and my family now lives in Carteret County in Harkers Island. And, you know, it can be and I think, you know, one thing I hope that this whole COVID-19 pandemic highlights is the need for additional resources to really assist these underdeveloped counties. We really don't want to stigmatize these counties any more than they have been stigmatized, which, you know, you often see in the media that, you know, people are not wearing masks, or, you know, they're going to work in person, or they're going and, you know, socializing, going to church. But it's also important to notice that things are easier for us to handle in urban counties. We have good Wi-Fi. We can work from home. We work in jobs where we can work from home. You know, we're more interconnected with a lot of our friends and colleagues. And so for like a lot of the eastern counties, like the way they socialize is going to church on Sundays. And it's just not the same doing that, say, remotely, which again, many of these households don't have access to good internet to do, say, a church service remotely as an in-person. And so we need to be mindful of the fact that, you know, moving forward, perhaps some of these infrastructure changes can help, you know, set up these counties so that they will, you know, so the response will be different the next time around. And even if there's not another pandemic similar to COVID-19, I hope that there's not. These counties are going to be impacted by hurricanes, other natural disasters, and potentially other, you know, infectious disease events. And a lot of the work that we do to now to mitigate the spread of COVID-19 may have long-term beneficial impacts in these areas. Randa and Arrianna, Natalie, West, do you have anything you'd like to add?
I think you covered it very well. You know, we know the state has limited resources, but the one thing that this pandemic has highlighted is the discrepancy and, you know, the impact on, as you said, not only undeveloped, underserved communities everywhere. And so I hope this is a lesson learned moving forward for all of us. So, okay. All right, unless somebody types something quickly, I'm going to thank everybody again and see you at the next webinar. Thank you, Daniel. Bye-bye.